My name is Dr. Jason Friday. I'm a psychiatrist. I'm board certified in general psychiatry and child and adolescent psychiatry. I decided when I got out of training that I wanted to make a big change in my community and a big change for psychiatry in general. And a big part of what I wanted to change was to bring the most advanced treatments, the most cutting edge and effective treatments that we can bring to this community. And certainly a lot of what I found to be lacking was the lack of progress, that a lot of the psychiatrists just weren't daring enough, I might say, to try some of the newer technologies. And so it was not growing as much as maybe other major educational centers, like you might find in New York or Chicago or something like that. And so I wanted to have doctors that were going to be able to learn about some of these new technologies in a way that was going to further our treatments and complement everything that the psychiatrists with medication treatments and therapies, and help to get the best outcomes possible.
Where is Redemption Psychiatry located?
So over the last 5 years, as we've been growing, we've opened up many different locations. We started out in Gilbert, Arizona, and then we moved to Chandler and Phoenix, Central Phoenix, and then opened in Glendale and a West Phoenix area as well. So we have 5 locations.
When did you first hear about TMS? How did you hear about it? And when did you decide it would be right fit for Redemption Psychiatry?
Got very little training on TMS in residency, which I think is a really sad state of affairs right now. Is that residents coming out should know the most about the most advanced treatments, be up on the research, and so it was really disappointing that we didn't get very much in residency, but it's not uncommon. So it wasn't until I founded Redemption Psychiatry and we were really trying to look at those advanced treatments, things that are really going to help people to get beyond medication and therapy. And as we were looking at all these different treatments, my doctors brought the idea of doing TMS to me, and I'm really passionate about it. And I have to be honest, I was kind of skeptical about TMS because I hadn't had any patients that had actually tried TMS, that actually had any improvements. And so I think some healthy skepticism is normal, but we're also looking to the future, looking to see, let's give things a try, let's look at the research, and let's try to bring that research to our patients and to find out how effective that can be. And I'm glad that we did. When we started doing TMS in 2015, we took our most difficult, most challenging patients that we were constantly making medication changes, trying and failing several different treatments, all sorts of therapies, and frankly the patients that we were the most concerned about. That in between visits, we didn't know what was going to happen. Were they going to end up in a hospital? Were they going to have a suicide attempt? Were they going to have a severe side effect from medication? And so being able to take those patients as we started and challenge the effectiveness of TMS, seeing that it can be so effective in treatment-resistant depression, we said, okay, we've got plenty of treatment-resistant patients that we're kind of finding that we're reaching dead end on, that we don't know what to do next. And I can't say enough about how astonished I was, how pleased I was to see the response of these patients. But I can honestly say I've never had any treatment that I've prescribed to anybody, whether it was a medication or whether recommending a course of therapy or sending to any kind of program, to have the same response that I've seen with TMS. To have those patients come back after the first month of treatment and walk in the door, regular medication follow-up, TMS follow-up, and have them leap up from the chair, give me a big hug with tears in their eyes saying, I can't believe I'm better. And I've never had that. And so I was immediately sold on TMS after the first few patients that we had treated. And so from that point on, we really been so much more interested to see where we can take that. What else can we do with TMS? Because to see how much better patients can get with that treatment-resistant depression, and to see all of the research that's going on, it's just it's exploding. It's very hard to keep up with all the different articles and publications that are coming out with so many different uses, and trying to see how different groups are replicating those studies, and when can we bring that to bear? When can we start those kinds of treatments for people? Some of the most amazing results that we've been seeing have actually been in treating things that I never thought that, as a psychiatrist, that I'd ever be treating. And frankly, that there isn't really even sometimes any good treatment for. So I'm really excited about the results that we're seeing with tinnitus treatment. People are suffering so much from this annoying sometimes sound to crippling sound that they're constantly hearing in their ears, and can affect them emotionally, can affect their sleep, can make it very difficult to be able to function in life because of that the hearing issue that comes with the tinnitus. And we're seeing that we're able to get some immediate results with this treatment in most individuals, and long-lasting condition that to be in a lower state or even resolve. So that's one that's definitely big on our list. But chronic pain syndromes, neuropathic pain syndromes, have been responding to TMS treatment, and especially a theta burst treatment, extremely well. And a lot of individuals that have the chronic neuropathic pain are not getting adequate relief. I mean, you look at the statistics and say 7% of people have some form of neuropathic pain, and less than half of them are getting adequate relief from medication treatment. And many of them that are maybe getting adequate relief don't want to have to be reliant on medications, or they're having side effects. And so to have a non-medication option that's really effective and gets them long-term relief without having to be in every day, to constantly take something and risk side effects, is really amazing. I think it's going to be changing the way that we treat pain in the future. Another really exciting development that for me personally, because of being a child and adolescent psychiatrist, I treat a lot of children with developmental delays and autism, tic disorders, and the efficacy that we're seeing for autism, for different movement disorders like tic disorders, Tourette's, has been absolutely amazing. We're just so excited about the direction that's going, because really many things that we're trying to do to help to treat these children have limited efficacy, and even there are people going and spending thousands of dollars on treatments for their autistic children that have no basis in research as to how effective they could be, but they're willing to do anything that they can find. And to see that we can reduce the level of irritability and rigidity and improve their executive functioning is just amazing. Families, they hear those areas of improvement that we can have with TMS for autism, and they immediately are like, wow, those are all the things that we're struggling with. Those are all the things that I'm trying to help my child with, and that it impedes our day-to-day life, and also impedes their ability to get adequate therapy. And so as we're reducing some of these obstacles that they have to getting adequate autism treatment, they're going to make progress well beyond what they would in just the therapeutic aspect of doing ABA therapy or any other kind of school interventions. So I feel like it's going to drastically change the way that we treat autism as well.
Do you have any personal stories to share about maybe a child that was treated with autism that improved with TMS treatment, and how did they notice the improvement?
What's interesting so far is that a lot of times it's really difficult to get people to give TMS a try. And no matter how much you tell people, look, this is an amazing treatment, that we're seeing results that we wouldn't be able to see with therapy and medications, they're really hesitant to try something new. And so what we've been able to do is those individuals that are getting TMS for depression, and that we get using the FDA approved treatment that is also covered by their insurance in most cases, we can often do an additional treatment that can help out with a particular problem. And so I've had individuals that have gotten the FDA approved depression treatment and doing some targeted autism treatment, and what we found is not only with the improvement in the depression, which of course would make it very difficult for an autistic child to make progress, but also the big benefit that we were seeing is that reduction in irritability, so that having fewer outbursts, reduction in rigidity, so the difficulty in keeping being flexible with a routine and being able to prevent those stuck moments where kids are just not able to shift their attention, and oftentimes that's one of the most challenging things for parents to be able to deal with, because until the child gets out of that loop and stops being stuck, then they're not able to move on to the next activity of the day. And that's just not how our lives work. We really have to be a lot more flexible. It can't all be routine. And so when they saw that difference in having improved flexibility and reduction in that trigger, the amount of irritability and outbursts, just amazing how much that changes the whole dynamic in the home.
If I were a patient considering treatment, my options for depression or another related mental disorder, what is it that I should know, that you'd want me to know about redemption psychiatry, as to why redemption is different from other practices in the area or in general?
Yeah.
And why would I consider coming to redemption over another psychiatric office?
In redemption psychiatry, I have put together a team of people that are really passionate about progress. They want to help to redeem families and our profession in general. There's a lot of negativity surrounding mental health, and the whole idea of redemption and redemption psychiatry is that we are trying to change the way that people view mental health treatment. And the redemption for an individual or for a family comes when that difficulty, that treatment-resistant problem, is finally is seeing the results that we've been trying to get for them for sometimes decades. And so that, I think, is really what sets us apart, is that we have not just one person who specializes in TMS and understands ketamine. Nobody can know everything. Nobody can be the right doctor for every person. And so even though we think, I'm going to go to the greatest mind in the country for, if they don't see you and they don't see who you are, then it doesn't matter how much they know. And having a team of doctors that we're all dedicated to learning the most about these advanced treatments and becoming experts at it, and consulting with each other and really trying to help further the advanced treatments for depression, for anxiety, for PTSD, for OCD, for bipolar disorder, and just see that we can help treat the untreatable. It's exciting, and see the passion that comes with that from all the doctors. We share our experiences, our research, and you don't get that from most practices. Most people are, on their own. They're maybe in some academic institution. The passion isn't about building up that practice necessarily, and the treatment of all the patients. It is much more either about the institution or it's about themselves. And here it's not about that. That's really what sets us apart. It is about changing the whole dynamic of our community and treating those patients in our community so that we get the best outcomes possible.
And your staff, that the other doctors you work with, they're also psychiatrists who specialize in adolescents, or?
Yeah, we have a lot of different psychiatrists and different approaches that everybody has, and so there's some of the greatest minds that I know. I feel privileged to work with them every day. We're learning from each other all the time, but we have some that are quite a few actually that are specialized in children and adolescents, as well as those that are just specializing in adults. It helps, I think, to have the range, because a lot of, especially like when I'm talking about treating some adolescent disorders like autism and tic disorders, and Tourette's and things like that. These are things that may persist into adulthood, but the adult psychiatrist doesn't have the same kind of training that the child and adolescent psychiatrist has in just that first exposure, in seeing how things are when they're at their worst, when the kids are trying to make progress. They see how things maybe get when they're into adulthood and they've settled into a different state of being. And sometimes they've kind of become complacent with, this is as good as it gets, I'm not going to make any more progress. And so having the specialists of all ages, I think, really helps to understand the whole person.